Now, this morning we're going to be opened up with the third of our four storytellers. Neil Myrick from Tableau is going to wow us with stories of big data, visualizations, and how we apply these tools and technologies to the most pressing social issues of our time. So please join me in giving a very warm welcome to Neil Myrick.
Good morning. So when we think of data people, we actually think, often many of us think of rooms like this. In this case, it's 13,000 data geeks all staring at the stage at Tableau's customer conference in Las Vegas. And it's crowds like this that we think about when we think about the women and the men who are on the front lines of the data frontier. But when we think about data people, a few of us think about people like Odinga Chitanka. That's Odinga sitting over there in the chair on the right. He's entering data into his mobile device from the malaria tests that he had just given to the people around him. Armed with little more than a high school education and a mobile device, Odinga and 1,200 community healthcare workers like him have been fanned out through the southern province of Zambia. They're part of an experimental project, and they go town by town and home by home, finding and treating people who have the disease. Now, Tableau is involved in this project thanks to our shared value partnership with PATH. PATH is an innovative global NGO who have been working in Zambia for more than a decade. And when we first joined the project, we recognized the fact that the Ministry of Health and PATH and all of their partners had done a tremendous job of dramatically reducing the number of malaria cases in that time frame. But because we're engaged as a partner and not just a donor, we've actually learned that the work that they've done getting to zero is a huge challenge. And the reason that getting to zero is a challenge is because of the way that malaria works. You see, malaria is caused by a parasite. It's a curable disease that kills more than 400,000 people a year, mostly children. And this parasite lives in our blood. Humans are the reservoir. And so when a mosquito bites somebody who has the parasites in their blood, the mosquito picks them up and it injects them into the next person that has been bitten. Now, the challenge is, in getting to zero, is that 80% of the people who carry the parasites in their blood are asymptomatic. They're not sick. So in working to eliminate malaria, we're fighting an invisible disease. But with this new information, we now know that when somebody is sick and they walk from their village to the clinic to get treated, health officials can see that person as a kind of canary in the coal mine. Because if they're sick, then in all likelihood, there are a bunch of people back in the village who are carrying the parasite and who don't even know it. And that is where Odinga and data come in. Today in the southern province, when malaria cases are identified, community health workers like Odinga are sent back to the village. They find and they treat everyone in the village who is carrying the parasite, whether or not the person is sick. They also help implement preventative measures like bed nets. And every action they take creates data. Those data are entered into mobile devices, they're sent into central systems, and then in no time, they're pushed back out to decision makers at all levels. And those decision makers, everyone from community healthcare workers all the way up to national health officials, are now getting timely access to information about the disease. And that timely access to the information is allowing them to make better and smarter decisions about how to allocate their scarce resources into fighting and eliminating it. Now, the good news is it's working. In the last 2 rainy seasons, there has been, the Ministry of Health has successfully decreased the number of malaria cases by 93% and the number of malaria deaths by 97%. And you see that huge spike on the right. That's more than 40,000 people who were diagnosed in the malaria high season in 2014. And you see that little tiny bump over there at the end. That's about 2,000 people who have been diagnosed at the beginning of the high season in 2017. So with results like this, the global health community is taking notice, and the Zambian government is actually gaining confidence. In fact, they rolled out their new malaria elimination strategy just a few weeks ago on World Malaria Day. Their plan is to be malaria-free by 2021. And for those of you who know, that's a bold objective. They also plan to roll this experimental project out from the southern province to the rest of the country. And we're really excited about that. We were also thrilled recently to find out that the Zambian government changed the name of their National Malaria Control Center to the National Malaria Elimination Center. And that's a move, it's a symbolic move. It shows confidence and it gives the Zambian people hope. We're really grateful to be part of this shared value partnership. And we're also grateful that we're starting to see that this notion of using data to fight infectious disease is starting to spread and take root in other countries. So thanks to this shared value partnership with PATH, we were also invited to join another project thousands of miles away in Vietnam. PATH was working with the Ministry of Health and the Centers for Disease Control to implement what's called an Emergency Operations Center for Disease Surveillance. And the center collects data from all over the country, puts it into a central system, and then pushes it out in interactive visualizations. Health officials can now see when and where infectious disease cases, like Zika, dengue, and yellow fever, are being diagnosed. And by getting that information in a timely manner, they can respond in a timely manner. And by responding in a timely manner, they can go make sure that those cases don't become an outbreak and that the outbreak doesn't become a pandemic. Now, the social value of these projects is pretty clear, right? But this is not the Social Value Summit, is it? It's the Shared Value Summit. So the innovation that's happening is identifying new ways to use data to fight infectious disease, but it's also showing how Tableau can provide products, services, and value into these often overlooked markets. In fact, back at Tableau's headquarters in Seattle, these are more than feel-good stories for our website. We actually spend a lot of time talking openly about this intersection between corporate philanthropy and corporate development. And by talking about it openly and exploring it, we've actually been able to learn a lot. One thing that we've learned is that by working outside of the normal boundaries of our operations in places that, say, are not within our comfort zone, we're actually able to generate new ideas all the time. And those new ideas are now turning into requests for product features that have been innovated in Africa, and they're features that not only help the work in Zambia, but they potentially help all of our customers. Those ideas are turning into discussions about how we may need to change our training curriculum to meet the needs of a new type of user. And they're even leading to discussions where the foundation guy is leading discussions about how we may need to change our licensing and pricing model in order to meet the needs of governments in developing countries. I'd say, though, the most important thing that we've really learned is from the people on the ground. So our model is we train people on the ground. We insist on making sure the community benefits and builds their capacity. And by listening to them and treating them as real customers, they really taught us a lot. The first thing that we've realized is that from a philanthropic point of view, we're building data capacity on the ground. But we've also recognized that we're also building a new generation of NGO and government worker. And this new generation of workers is not only becoming a data champion, but they're becoming Tableau champions. And we've listened a lot to them, and they've taught us something really important about this intersection between our philanthropy and our corporate development. And that is that for people who are working to improve the well-being of others, impact is the value they're trying to achieve by using our products. Let me say that again. For people working to improve the well-being of others, impact is the value they're hoping to achieve from using our products. Now that informs our philanthropy, because now we know, as a social impact team, if our social impact projects are successful, we're not only achieving our social impact mission, but we're potentially building demand for Tableau for decades to come. And that's why we believe in shared value. Thank you.